Hey guys, it's November 24th and I wanted to give you a update. Today is officially my 8th day of my liquid pre-op diet. Not too shabby, I will say. Not bad at all. Still doing the pure protein shakes. Not doing as much protein as I first started off with, which is my own fault. So I had to kind of get into doing that more. I have 3 days off. Yay for the holidays. So it's going to be basically focused on cleaning my house, getting things arranged for surgery. So it's in 6 days, y'all. It's crazy. I did do measurements, and last week I did them on Monday, and then yesterday was Monday, so I took measurements again and I lost 15 inches all around, which isn't too bad. Friday on the 20th I weighed in at 224, and then I weighed in again today at 222. So I mean, it is still going down, which is a great thing. I kind of feel like instead of like woo all the way down, it's just kind of, oh, let's just, but it usually does that. I usually get to around 200 and it won't let me drop below that, so we'll see how this goes. I don't really know what to say, so this next part I may or may not get emotional, and I apologize. I got a call yesterday from Kim, the bariatric nurse, who told me that Dr. Tanner had some concerns in regards to my EKG. If you don't know what an EKG is, it's where they put all these little sticky things on you and hook them up to a machine, and it reads your heartbeat. She looked at the one from Methodist and noticed I had a cardiac arrhythmia, which is basically irregular heartbeat. And she compared it to the one that I had done at UNMC, and she said there was a reason for concern. So she said in order to get the surgery, I had to have cardiac clearance. So considering my surgery is 6 days away and it's the holiday, I had to have my appointment today at 2 o'clock. So I go in there, I get weighed, I get my blood pressure taken, which was 132/86, which for me is really high. And then they hook me up to the cardiac machine, and I was like, how's it looking? And she's like, well, the doctor will be in to discuss your results in a minute. And I was like, okay. So I'm just chilling on this table, and he comes in, asks me a bunch of nonchalant questions, and tells me that my EKG is concerning. And I was like, what do you mean it's concerning? He's like, well, it's abnormal, so we're going to have to run a couple more tests on you. We're going to have to do a EOC or something. And he mentioned another test that I have to do, and then a treadmill test. So the nurse is like, when? Her surgery is on Monday. And he's like, oh, let's do it tomorrow morning. So I have another appointment tomorrow morning at 10 o'clock. And I was like, what's abnormal about it? Like, what's wrong with it? What's wrong with me? And he was like, well, your heart doesn't know. How do you put it? He says that, okay, look at this. This line is your heart beating really fast. And then this right here, this little pause, is your heart skipping a beat. And then this area, you notice how the lines aren't as close together as they were up here, means your heart's slowing down. So your heart is going from fast, skipping a beat, to slow, to fast, skipping a beat, slow. And then periodically it'll change up its rhythm. It'll go skip a beat, fast, slow, fast, skip a beat, whatever. It's like, it doesn't, he said it doesn't have a rhythm. And so he said that we'll know by the end of the tests tomorrow whether I'm cleared for surgery or not. He said it's basically like my heart's struggling, which is a surprise to me because I've never had an issue with my heart before. Like, I've never been told I have cardiac arrhythmia. Methodist never said anything when they did the EKG and they scheduled me for surgery. So I don't know what to make of it. Like, I don't know. I haven't told my parents because my dad is a trigger to my anxiety. He just kind of fucking goes and 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 doesn't know when to stop. So I didn't want to bring it to their attention until there was something to be concerned about. Now, to me, something to be concerned about is a cardiologist saying that your heart doesn't have a rhythm. It kind of does whatever it wants, and it's like it's struggling. And so, to me, that's a concern in itself. I don't know. My dilemma is, okay, I want to tell them really bad because I want to keep them in the loop, because they're taking work off for surgery. They're scheduling their week around me getting surgery. So I feel like they have a right to know, but also I don't want to let them know because they'll trigger my anxiety. And what if it's nothing? Like, what if it comes back, yeah, you just have extraordinarily bad cardiac arrhythmia and you'll be fine. We just had to monitor you and have you hooked up to a heart monitor throughout the surgery. Like something like that. I don't know. I'm kind of torn between the two. And I'm also pissed off because it's like I was more healthy when I was overweight than I am right now. And it's just like my heart's like, oh, your surgery's in 6 days. Let's fuck some shit up. Let's just go off the Richter scale and see if these guys can figure out what's wrong. Like, it's very frustrating and disheartening. Like, I don't know. It really is frustrating. So I had to push my appointment with Tara back later today, so I'll let her know what's going on. It's so frustrating. I could just rip my fucking heart out and shake it. Like, fucking find a rhythm. But I can't, because then I'll die. Like, I don't know. Family's coming to town tomorrow, so that'll be fun. I'll get done with my appointment. I had to go over there and be like, hey, guess what? I'm not having surgery because thanks to your genetics, my heart's fucked up. I'm just kidding. It's not my parents' fault. It's I don't know whose fault it is. It's not my parents. But I don't know. Heart problems run in the family, so it's not a surprise, but it's a surprise I'm finding out 25 years later. I've never had an issue before, but meh. Whatever. You win some, you lose some. So hopefully I don't lose a surgery date, because that would fucking tear me apart. I don't know what I would do. I would be so sad. Meh. But we'll find out tomorrow, so hopefully everything goes well, everything is cleared, and I can get it done. So now is just kind of a waiting game. We wait and see. So I'll update you tomorrow after I get done and let you know whether or not I'm having it. We'll see you guys later.